I think it's appalling. The government approach to discharging patients from hospitals back to care homes was absolutely appalling.
Well, David Crabtree, you run 2 care homes in Yorkshire. We've now heard the Prime Minister say unequivocally that the care homes were advised to lock down before the public, before March the 23rd. And secondly, we've heard the Health Secretary, Matt Hancock, and Michael Gove both say a protective shield was put around care homes. What is your reaction to those statements?
Incredulous. On the 2nd of April, the government's advice was, if an individual has no COVID symptoms, then the care should be provided as normal. No PPE, no testing for asymptomatic discharges from hospital, and my care homes were infected by discharges from hospital of people who, 3 days later after discharge, developed signs and symptoms and consequently sadly died.
I mean, the first advisory that we can find from the government that people should be tested before they go back to care homes was April the 15th, which is 3 weeks after the national lockdown. And Boris Johnson claims the lockdown in care homes was before even that. This is just a lie, isn't it?
It's an absolute lie. Matt Hancock on pre-election came to visit my care home. He met with the lady and was 101, an ex-RAF driver during the war. And sadly, she died of COVID in hospital only a couple of weeks ago. This is an absolute outrage. Who? All I want to know is who sat down in a meeting, basic cross-infection control, and decided, having watched Europe, that we should now discharge people into hospital with active COVID. I have a letter dated the 31st of March from the local CCGs saying that care homes should help create capacity in hospitals and allow COVID into care homes. This morning at 8 a.m, my care staff are going into a care home where 7 people died of COVID, and still today the residents have not been tested.